One of the things we've been seeing and focusing on is return to sport after this break that has been the COVID pandemic. We are seeing a lot of athletes and high-level athletes who unfortunately had to take extended periods of time away from their sport and away from a lot of physical activity in general. Even with just virtual schooling and not getting up and walking around as much as normal, we've seen activity levels drop significantly. And now that things are opening up and kids are going back to sports, our main concern is trying to prevent injury. We've been seeing an uptick in the amount of injuries, particularly things like ACL injuries and even some more uncommon injuries like Achilles tendon ruptures in patients that we normally probably wouldn't see because of this time away from sport. So as kids are getting ready to get back into their sports season, I think it's important to encourage them to do some cardiovascular fitness, even if it's getting outside and walking, hiking, jogging, running. And then before we actually play a sport, we want to make sure that that kids are warming up properly. So jogging or biking can help get just heart rate up, get the muscles warm, and then we want to make sure that there's a good focus on stretching prior to activity. One of the things that we see the most as a cause of injury in our teen patients is muscle tightness. A lot of kids have gone through growth spurts during the COVID break, and now things may be different. So making sure that we really work on flexibility will keep a lot of our athletes out of trouble. So warm up, stretch, and then start working slowly into activities. Even as kids, they need to be a little bit patient with their bodies as they're getting back into sports because of this time away.
Hi, my name is Caty Halpin. I'm the Sports Medicine Coordinator for Physical Therapy and Sports Medicine Centers and an athletic trainer at Westbrook High School. So since a lot of athletes had almost a full year off from activity, we're seeing a lot of injuries kind of later on in the season that are coming to light. At the high school level, we've definitely seen a lot more sprains and strains, and much of that is related to muscle tightness and weakness. We've definitely seen an increase in overuse and repetitive stress injuries, mostly from athletes just jumping right back into sports and motions that their bodies are no longer used to. And athletes have been living a much more sedentary lifestyle over the past year, so we're seeing the effects of the virtual classroom, and that's related to hamstring and hip flexor injuries as well as neck and upper back issues. It's important to make sure you're preparing your body for sport first, and that doesn't just mean playing the sport that you're intending on doing. It's about increasing your cardiovascular endurance and flexibility, as well as focusing on form and technique. My recommendation, no matter what level athlete you are, is to ease back in slowly. Start with dynamic stretching and mobility, and then slowly increase low impact cardio and low volume cardio as you feel more comfortable and your body adapts to that. Also, listen to your body. If you're having pain in one area for a period of time, make sure that you're addressing it appropriately so that it doesn't worsen. And fuel your body with adequate hydration and nutrition, because different hydration and nutrition needs are going to increase as activity increases as well.